who embody the mission of our organization, which is to improve the health and safety of adults and children across the country. They have forged their achievements in a system that does not easily bend to change, as many of you in this room know. And they've been improving health policies and ensuring that government agencies are held accountable. Their efforts have saved lives and improved the quality of life of millions of Americans. And those are Americans who are left out of the policy debates and left out of the policy decisions, but whose lives are affected by those policy decisions every day. And in addition, as we have for several years, we are also celebrating 4 pioneering women for a lifetime of achievements that have improved the lives of adults and children in our country. It's so easy to lose sight of how times have changed, but our foremothers remember those times. They wouldn't take no for an answer. They broke through glass ceilings before it was fashionable. And their tenacity, creativity, and dedication helped open up a world of opportunities for women in the 20th century and now the 21st century. Ranging in age between 83 and 97, they continue to be active long after they were expected to retire, and they're powerful role models for all of us, women and men. So we're honored to have these extraordinary individuals with us today, and we know that you're going to enjoy hearing from them. Let's give them a round of applause. I want to quickly thank our sponsors, without whom this would not have been possible. Special thanks to our platinum sponsors, Quill Office Supplies and Scheller. We are also very grateful to Morgan Stanley, the Congressional Federal Credit Union, and the Sugar Association. And I also want to give a special thanks to a few exceptionally generous individual donors, especially Mike Berman. Thank you, Mike. And to Dr. Susan Wood, Catherine Joyce, Dr. Nancy Hart, Tom Bell, Peter Hart, and Phyllis Wiesenfelder. Thank you very much. And I promise I'm almost done. We're going to start eating in a second. I just want to also say that there are a lot of nonprofit organizations here today who are here to share in this celebration, and we're really very grateful to them. These are our coalition partners in many cases. These are groups we work with all the time and who care very deeply about the health of all Americans and who are doing wonderful things. And I just want to briefly list the names of those organizations and ask that their representatives, stand. The American Association of University Women, the Center for Lobbying in the Public Interest, the Center for Science in the Public Interest, the Coalition on Human Needs, the Community Access National Network, the DC Cancer Consortium, the Government Accountability Project, Jacobs Institute for Women's Health, the National Consumers League, the National Women's Health Network, the National Organization for Women, the Ovarian Cancer National Alliance, the Pan Am Liaison Committee of Women's Organizations, the Reproductive Health Technologies Project, Scientists and Engineers for America, and US PERC. Thanks to all of you for your participation. Okay, it's time.